Asthma. Symptoms. Causes. Prevention. What is asthma? Hello friends, today we are going to discuss the asthma. Asthma is a condition in which your airways narrow and swells and produce extra mucus. This can make breathing difficult and trigger coughing, wheezing and shortness of breath. For some people, asthma is a minor nuisance. For others, it can be a major problem that interferes with daily activities and may lead to a life-threatening asthma attack. Asthma can't be cured, but its symptoms can be controlled. Because asthma often changes over time, it's important that you work with your doctor to track your signs and symptoms and adjust treatment as needed. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like, share and leave a comment below. Symptoms of asthma. Asthma symptoms vary from person to person. You may have infrequent asthma attacks, have symptoms only at certain times, such as when exercising, or have symptoms all the time. Asthma signs and symptoms include shortness of breath, chest tightness or pain, trouble sleeping caused by shortness of breath, coughing or wheezing, a whistling or wheezing sound when exhaling. Wheezing is a common sign of asthma in children. Coughing or wheezing attacks that are worsened by a respiratory virus, such as a cold or the flu. Symptoms of asthma, continued. Signs that your asthma is probably worsening include asthma signs and symptoms that are more frequent and bothersome. Increasing difficulty breathing, measurable with a peak flow meter, a device used to check how well your lungs are working. The need to use a quick relief inhaler more often. For some people, asthma signs and symptoms flare up in certain situations. Exercise-induced asthma, which may be worse when the air is cold and dry. Occupational asthma, triggered by workplace irritants such as chemical fumes, gases or dust. Allergy-induced asthma, triggered by airborne substances, such as pollen, mold spores, cockroach waste or particles of skin and dried saliva shed by pets, pet dander. Causes of asthma. The fundamental causes of asthma are not completely understood. The strongest risk factors for developing asthma are a combination of genetic predisposition with environmental exposure to inhaled substances and particles that may provoke allergic reactions or irritate the airways, such as indoor allergens, for example house dust mites in bedding, carpets and stuffed furniture, pollution and pet dander. Outdoor allergens, such as pollens and molds. Tobacco smoke. Chemical irritants in the workplace. Air pollution. Other triggers can include cold air, extreme emotional arousal such as anger or fear, and physical exercise. Even certain medications can trigger asthma, aspirin and other non-steroid anti-inflammatory drugs, and beta blockers, which are used to treat high blood pressure, heart conditions and migraine. Urbanization has been associated with an increase in asthma. But the exact nature of this relationship is unclear. Asthma triggers. Exposure to various irritants and substances that trigger allergies, allergens, can trigger signs and symptoms of asthma. Asthma triggers are different from person to person and can include airborne substances, such as pollen, dust mites, mold spores, pet dander or particles of cockroach waste. Respiratory infections, such as the common cold. Physical activity, exercise-induced asthma. Cold air. Air pollutants and irritants, such as smoke. Certain medications, including beta blockers, aspirin, ibuprofen, Advil, Motrinib, others, and naproxen, Aleve. Strong emotions and stress. Sulfites and preservatives added to some types of foods and beverages, including shrimp, dried fruit, processed potatoes, beer and wine. Gastroesophageal reflux disease, GERD, a condition in which stomach acids back up into your throat. Risk factors of asthma. A number of factors are thought to increase your chances of developing asthma. These include having a blood relative, such as a parent or sibling, with asthma. Having another allergic condition, such as atopic dermatitis or allergic rhinitis, hay fever. Being overweight. Being a smoker. Exposure to secondhand smoke. Exposure to exhaust fumes or other types of pollution. Exposure to occupational triggers, such as chemicals used in farming, hairdressing and manufacturing. Complications of asthma. Asthma complications include signs and symptoms that interfere with sleep, work or recreational activities. Sick days from work or school during asthma flare-ups. Permanent narrowing of the bronchial tubes, airway remodeling, that affects how well you can breathe. Emergency room visits and hospitalizations for severe asthma attacks. Side effects from long-term use of some medications used to stabilize severe asthma. Proper treatment makes a big difference in preventing both short-term and long-term complications caused by asthma. Asthma prevention. While there's no way to prevent asthma, by working together, you and your doctor can design a step-by-step plan for living with your condition and preventing asthma attacks. Follow your asthma action plan. Get vaccinated for influenza and pneumonia. Identify and avoid asthma triggers. Monitor your breathing. Identify and treat attacks early. Take your medication as prescribed. Pay attention to increasing quick relief inhaler use. Contact your doctor. See your doctor. If you think you have asthma. If you have frequent coughing or wheezing that lasts more than a few days or any other signs or symptoms of asthma, see your doctor. Treating asthma early may prevent long-term lung damage and help keep the condition from worsening over time. To monitor your asthma after diagnosis. If you know you have asthma, work with your doctor to keep it under control. Good long-term control helps you feel better from day to day and can prevent a life-threatening asthma attack. If your asthma symptoms get worse, contact your doctor right away if your medication doesn't seem to ease your symptoms or if you need to use your quick relief inhaler more often. Don't try to solve the problem by taking more medication without consulting your doctor. Overusing asthma medication can cause side effects and may make your asthma worse. To review your treatment. Asthma often changes over time. Meet with your doctor regularly to discuss your symptoms and make any needed treatment adjustments. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like, share and leave a comment below.